Hello, everyone, and thank you for listening to IFFGD's Patient Illness Experience program. The information and resources shared during this program should not replace any medical care that you are currently receiving. It is always important to consult with your healthcare provider before making decisions about your treatment plan. So today we have the pleasure of speaking with IFFGD's Patient Advisory Committee member, Jason Clay, about his illness experience while living with gastroparesis. Hello, Jason, and thank you so much for joining us today.
Hello, thank you for having me. I'm excited to be a part of it.
Yes. So for those of you listening, gastroparesis is actually a GI disorder that is estimated to affect up to 5 million people in the United States. In recent online study conducted by IFFGD here in 2019, patients were actually asked about their current state of health, and on a scale of 0 being the worst possible health, as bad as death, and 100 being normal, as a normal healthy lifestyle can be, 75% of respondents said that their current state of health was 50 or below. So gastroparesis is characterized by symptoms like nausea, vomiting, stomach pain, discomfort, dry heaves, stomach fullness after a normal sized meal, and early fullness, and the inability to finish a meal. And you're nodding your head, Jason. I'm sure some of these symptoms you can relate to, but all of which of these can make the disorder range from life limiting to life threatening for many patients. So today we're speaking with Jason about his illness journey to help raise awareness about gastroparesis. So, Jason, can you share with our listeners today when you were clinically diagnosed with gastroparesis and what that process was like for you?
Certainly, I was fortunate compared to some, but I was diagnosed in 2012. I became ill. It was very sudden onset. I was actually on a business trip and wasn't feeling well. Was very bloated. Had It was a weird sensation of feeling like I needed to vomit, but I couldn't quite do it. It wasn't quite nausea, but it was this feeling of just extreme fullness. Something I'd never really experienced before. So I called my wife. I said, I need to get into the doctor as soon as I get home, and I did. It was about a week later, and I tried PPIs for a little while with my doctor. He thought maybe it was just a little bit of gastritis, a little bit of GERD type symptoms. The PPIs didn't work. So he immediately sent me on to a GI, which I was very thankful for.
Yeah.
Uh, I got sent to the GI. That was within a month. So that was probably the beginning of June when I first saw my GI in 2012. My GI was very proactive. He, again, tried some medications, immediately did an endoscopy to see if he could see what was happening, and saw the food left in my stomach after a significant period of time. I'd go, say, 2 or 3 days without eating, and then he'd still see the remnants of the food, the meal in my stomach. So he was alarmed, and he tried again a couple of weeks later, tried another scope to get a better look, and asked me to diet or fast for a little longer so he could get in there and see better without all the food in my belly, and saw still that I had quite a bit of food left. So he immediately ordered a barium swallow and a gastric emptying study. And I had my gastric emptying study in mid-July of 2012. And that's when
Mhm.
I received my official diagnosis of gastroparesis. So the whole process went very quickly, uh,
Yeah.
comparatively speaking to some.
Yeah, that's what I was just about to say. For some people, it takes much longer for them to be diagnosed with gastroparesis, but still, even through your journey of it being such a quick turnaround for you to be diagnosed with gastroparesis, you still spent that time with those symptoms that you weren't sure about, that you really didn't have many answers to.
Absolutely. It's a frightening thing when I felt something I'd never felt before. I didn't know exactly what it was. You start, of course, doing research on your own, and you come up with
Mhm.
answers you don't want to hear from Google, and so you get to your doctor, and they don't know, unfortunately. My
Yeah.
primary care didn't know, and my gastroenterologist, he told me, and his wife was also an MD, and he said we've been poring over journals together
Mhm.
trying to figure this out. We don't know what this is. I think it's gastroparesis, but I don't know what's causing it. And he immediately was very, very humble,
Wow.
was very gracious, and he said, "I'm sending you to a motility specialist." I was in Northern California at the time, and he sent me to a specialist in San Francisco, and was just a very, very quick process for me. I was so thankful for it.
Yeah, sometimes you need some of those doctors who can say that they don't know and feel
Right.
comfortable enough to basically turn that patient over to someone who might know so that they can get those diagnoses to help them with their symptoms and to start living a better quality of life as much as they can. So, since being diagnosed, do you still suffer from GI symptoms? And if so, what is that like for you day to day?
Yes, it's still a daily struggle. I've been through many motility specialists. I've had several procedures done, um, and it's still a struggle for me. The symptoms can ebb and flow. I certainly have those times of what they call flares, where the symptoms are worse. But I have a daily nausea. I retch frequently. I don't vomit often, actually
Mhm.
expel food, but I retch quite a bit. I get quite a bit of regurgitation. I have significant pain daily, so it's quite impactful.
Yeah. And so does some of these symptoms impact like I'm not sure if you go to work or any social interactions with other people or just really anything that you would like to engage in, how do some of your symptoms maybe impact that?
Well, I tell you that my gastroparesis, it actually cost me my career.
Wow.
I am disabled now. I was actually working in my dream job. I used to manage the multi-state electric grid for the Western United States. And I enjoyed that job. It had been a job that I had dreamed of having for many, many years. And I spent 25 years in the field. And then I just couldn't keep up the pace anymore. The fatigue, the nausea, I got to the point where I wasn't thinking clearly, that mental fog that comes over you. So I didn't trust myself to make the decisions that I needed to make on a daily basis. And I finally retired. I was fortunate that I had a long-term disability policy through my employer. So I went out on long-term disability, and I have been declared totally and permanently disabled as a result of my gastroparesis.
Wow. Thank you for sharing that. And I kind of got a little emotional because I'm just thankful that you are able to share that with us because so many people maybe don't know about gastroparesis yet. And hopefully, through this, they can understand the impacts that this chronic GI disorder can have on a patient's life, not only just with the symptom burdens, but also just how it impacts your social work life. So, through your illness journey, what have you really learned about gastroparesis that you feel is really important to raise awareness about?
Well, I think the points that you just hit on are key. I think there's a lack of awareness of the disease as a whole. I don't think many people have heard of it. I certainly hadn't
Yeah.
before I was diagnosed. And especially in men, the illness predominantly affects women. They don't know exactly why. Um, so I really like to raise awareness with men because I see men struggle with it even more so. Um, and it's so hard to find those answers. I've done quite a bit of research on my own. I've been fortunate to be involved with the IFFGD and some other organizations, some of the groups that uh, try to help, especially newly diagnosed people and the Facebook
Yeah.
groups and things like that. Um, but it's been quite the journey for me to understand just how limiting it can be, how impactful, how different it can be for everybody. I
Yeah.
think it impacts everyone a little bit differently. Everyone maybe has a different onset or different symptoms and different severity. And it's not always about some of the tests that show, say, like the gastric emptying test that will show a severity of how delayed you are, but that's not necessarily the most important thing. And I think they're finding that more and more that your symptoms or your tests, I should say, your test scores don't necessarily equate to the severity of the symptoms and
Yeah.
the impact that it has on your life. And those are some things that are I'm learning the hard way because you sometimes feel when you feel better, you sometimes you feel there's some guilt that goes with it, and you have a good day and you feel like, I man, I should be working, I should be doing more. And then you have those bad days and you go, man, there's no way I could imagine doing these things. So you have to learn as you go to accept that this is what your life is now and what your body is allowing you to do. And you just learn to roll with those punches.
Yeah, yeah. And understanding what is the new normal for you and what does that look like, and have compassion really for yourself. Because like you said, it does vary. Gastroparesis does vary from patient to patient and from day to day. I'm sure you can attest that it might, like you said, it might be different. It might be different for you day to day, and just having compassion and knowing that whatever your body allows you to do that day is okay. Yeah.
Absolutely. That's what I was just going to say. That's one of the hardest things I actually struggle with is knowing that today's a bad day and I need to just rest today, and tomorrow might be a better day. And I've had it since 2012. So it's been, 11 or 9 years and almost 10 years that I've had this disease now. And um, I still struggle with that.
Yeah, yeah, but you're so strong and so brave, especially to continue to help raise awareness and share your story to really help, like you said before, some of those newly diagnosed patients who are really searching for resources, searching for answers, and just support. And knowing that they're not alone in this journey and that you're not alone is very impactful for many patients out there. So thank you for really sharing your story. But when we talk about some of the obstacles that you've kind of touched on here throughout the program, what obstacles have you overcome? And how do you feel that the support from your family, friends, or even some of the support groups that you may have joined have helped you through some of those challenging times?
Well, I tell you, it's been a huge impact on my family, and we've actually moved. We relocated to a different state when I was forced to retire early with this, and when I was declared disabled. So it's been a big impact for my children. They've had to change schools. It's been a big impact for my wife, who's gone from working her normal 9 to 5 job to being self-employed and running her own business now, so that she's more flexible when my doctor's appointments come up and things, so she can be helpful. It's really turned her world upside down. It's those obstacles, that I think sometimes people don't always think about. It's not just you. It's of course it's you're the one that's sick and you're the one that's struggling with that day-to-day illness, but it impacts everyone around you. And so my wife and my children are the huge have a huge impact, and even my wife's parents came with us because they wanted to be with their grandkids. So I mean, I
Mm.
feel somewhat responsible even for that, the fact that they changed and moved out of state, and everyone's come so that they can be around a family and support this journey that my family has been on with my illness. And it's been overwhelming at times, to be honest, and it's to feel the love and support that I've had from my family, and those obstacles, and then just those obstacles of awareness with the disease. Like I said, for the newly diagnosed patients that are just searching for the answers that they can't find. I see so many people that are told by their doctors that they have gastroparesis, and here you go, and try
Yeah.
not to eat a couple of things, and then they just sort of are left to flounder on their own, and they aren't fortunate enough to get to maybe a motility specialist in one of the centers around the country, and they have a doctor that maybe, I don't want to say treats them like a science experiment, but I think there are some doctors, unfortunately, that are interested. They're curious in this disease on their own, and so they want to try to help, and they want to try to fix things for people. And they sometimes, if they aren't familiar with the disease, this becomes a drawn out process for people. So
Yeah.
helping those people and overcoming those obstacles of getting access information to people is huge, and I'm so glad that I can be a part of that.
Yes, yes. And honestly, just being able to share your story is just one of those things too, so that people know that, like I said before, they're not alone. And even with, I'm so glad that you touched on the fact that it's not just the patient who suffers from gastroparesis, but you have caregivers out there who are supporting these patients who are living. And it's like what you said, it impacts everyone around you, and just knowing that you have that support and that other people might have that support, I'm sure on some of the toughest days for you, it just lifts you right back up because you know that where you might be at 50%, they have the other 50 and they can help get you through the entire day. So, and I'm thinking about all of the research award winners that we've had the pleasure of speaking to this year, and what you were saying about how they're interested in this disease. And it's like you said, not a science experiment, but when patients go into their office, it's so important to communicate because you never know what doctor you might be interacting with who might be interested in really helping advance the field of research for gastroparesis. And with that, you're sharing your story and you're helping other patients as well. So,
I've been very fortunate in that way. I actually became much more active on Twitter once I became sort of involved with IFFGD and some of the Facebook groups. I'm an administrator for a men's gastroparesis group, and once I became active on Twitter, I started getting involved with more doctors and more research, and seeing that that interest is out there. It gives you hope.
yeah,
These doctors are out there and they're working hard and they're trying to find solutions. And I don't want to say a cure. I don't know that if there is a cure, but I know that they're working hard towards trying to find one, or at least a solution that makes it livable for people,
yeah,
and get that 50% score a little higher.
yeah,
And I appreciate that so much. And I see people so often so downtrodden in the Facebook groups, and they've just gotten to their last straw, where the nausea and the constant pain and the fatigue has gotten to them, and they just can't take another minute of it, and they just feel hopeless. And I want to say to them, and I often do, and I can say, no, there is hope. There is work being done. There are organizations like the IFFGD that are out there working on your behalf, and they're trying to get this awareness out there, and their doctors are out there and they see you,
yeah,
and they want to help you, and you're not just a number to these doctors. And unfortunately, I think with insurance the way it is and medicine the way it is, sometimes people can feel like it's an assembly line.
yeah.
But there are good doctors out there that care, and you can find them and they can help you, and they want to help you do the best that you can and live the best life that you can.
Yeah, make it manageable and to hopefully live a better quality of life in whatever way that may be for you.
Absolutely.
Um, and you're talking about just a lot of the journey really, and your experience of living with gastroparesis is extremely impactful. But what other ways maybe has your illness experience helped shaped you as a person and who you are today?
Well, I can tell you this: I was raised sort of in an environment where I always thought that maybe there was some fraud in the disability system, or maybe people were kind of exaggerating their symptoms, or I always thought you should sort of, you know, pull yourself up by your bootstraps and just tough it out and work. And so this has completely changed my outlook on that. I've become a much more compassionate and understanding person. I've realized that not everyone, and in fact, most people that are disabled and are going through that system aren't there to scam the system, that these people are really sick and they need help. And that's
Yes.
okay. And we as a society need to help those people. And we as a society need to understand that there are illnesses out there that maybe we haven't heard of. and maybe we don't understand, but that doesn't make them any less real. And it
Mm,
doesn't make them any less impactful for those people that are suffering with them. And it doesn't have to be some big name disease that everyone may have heard of, that there's a lot of research dollars being poured into for it to completely turn someone's life upside down. And
right.
I admit that, I changed my outlook with a bit of shame, because I'm embarrassed of the person I was, that I had such a skeptical view. And now to completely turn that on its head and become much more understanding, and much more um, sympathetic and empathetic to the journey
Mm.
that people go through. It's just been a humbling experience for me.
Yeah, and it's just what you said before too, about everyone's journey is different. Some people go on 6 years before being diagnosed. Some people have mild symptoms. Some people have severe. So it's just what you said. It's a different journey for everyone. And just by you being able to say that you have learned that just because it's not one of those commonly known GI disorders doesn't mean that it's not as impactful and impacting people's daily life. And I'm really glad that you're just sharing your personal story. I mean, honestly, it's extremely impactful just for me to hear just about how things may have shaped you from before and how you view things now. And I'm sure that that helps you show even more compassion, even in the support groups that you're in for people who are newly diagnosed, still trying to figure out this journey. And that makes you an even better ally for a lot of these people who are suffering from gastroparesis. So, yeah, as we begin to kind of wrap things up, do you have any advice, words of encouragement that you would like to really share with anyone who might be listening today?
Absolutely. I just want to say, keep going, keep putting one foot in front of the other. I understand those days come when you just can't get out of bed, or that it just feels hopeless, that there's no cure on the horizon, that there's no more medications to try, that there's just nothing more that you can do. And that's not true. There are good doctors out there. There are people that want to help you. There are organizations like the IFFGD that are out there working for you. And there are people that believe you. I see
Yeah.
so many people that say that they just aren't believed, and that frustrates me, because I was so fortunate that I was believed immediately, and I was
Hmm.
so fortunate that I was diagnosed so quickly, and I feel so sorry for the people that have to go through these 6 year struggles, that aren't believed right away, and and they think it's all in your head, or it's not as bad as you make it out to be. That's not true. It's a different journey for
Hmm.
everyone, and there are people that believe you, people that
Hmm.
understand what you're going through, people that have walked in those shoes, even though their journey may not be exactly the same, even though they may not take the exact same footsteps that you're taking. They understand the path, and they understand the journey and the struggle, and they're there to listen and lift you up and help you and give you advice and encouragement, and maybe direct you to somebody that can give you a little more knowledge and a little more information, and they want to listen.
Yeah.
Don't give up.
Yeah. And we're just really hoping that through this program and through this interview that we have increased the awareness about gastroparesis and the impact that it has on patients' day-to-day life, and really just what is it like to live with gastroparesis day to day. And Jason, we just really appreciate you providing us with the time to share your journey with us, your illness experience, because it's very unique, but it's also very common for many of those, like we said before, 5 million people in the United States who are estimated to live with gastroparesis. So, although this disease may, or your story is unique to you, it's very common amongst other people. And we really appreciate you for sharing your illness experience with us. And we also just want to say thank you to all of our listeners today for the IFFGD Patient Illness Experience Program. Um, we just really enjoyed hearing your story, and we just hope that we can help raise awareness and continue to push the needle forward to encourage more research and continue to increase the public knowledge about gastroparesis. So thank you so much for sharing your unique insights on this topic, Jason.
Thank you. Thank you very much for having me.